Edutainment Studios welcomes you to Non-Small Cell Lung Cancer Treatment Guide. This module is part 3 of a 6-part series on non-small cell lung cancer. Most people who have lung cancer have non-small cell lung cancer, or NSCLC. Although it's serious, treatment can sometimes stop it from getting worse. There are things that you can do to help yourself feel better. If you smoke or breathe a lot of smoke, you are most likely to get NSCLC. Non-small cell lung cancer accounts for about 85% of all lung cancers. It develops in the cells lining the bronchioles, which are small branches off of the trachea, and the alveoli, which are tiny air sacs at the end of the bronchioles. In this course, the objective is to help you explain how to treat NSCLC. You will have a team of doctors involved in treating your NSCLC. They will work with you to recommend the best type of treatment based upon the stage of your cancer, the results of your tests, your overall health, and the risks as well as the benefits and side effects of each treatment. A combination of treatments can often be used together. It is important to understand the main goal of the treatment, which is usually based upon the stage of your cancer. Complete remission is when the test results no longer show any signs of cancer. The earlier the stage, the more likely this will be the goal. Control is when the cancer is still present but not progressing. If the cancer has spread to the point that complete remission is not possible, the goal may be to control it. Comfort is when the symptoms are treated but not the cancer itself. This is usually the last resort treatment goal when other options have failed. Surgery is when your doctor surgically removes the tumor from your lung. Surgery may include removing only a part of one lobe, an entire lobe, or the entire lung. You are most likely to have surgery when your cancer has not spread beyond the nearby lymph nodes. If it has spread further, or if surgery cannot fully remove your cancer, the doctor will suggest other types of treatment. Radiation therapy uses high-energy radiation to kill cancer cells. The doctor can aim the rays at the cancer from outside of your body. Alternatively, the doctor may use a needle or small seed to place radioactive material inside your body near the cancer. Radiation treatments generally only last for a few minutes. You may undergo treatment 5 days a week for 5 to 7 weeks, or only 1 to 5 times in total if newer procedures are being utilized. If the tumor is too big or has spread too far for surgery, the doctor may recommend radiation. You may have radiation therapy in combination with chemotherapy before or after surgery, or to help relieve symptoms. Chemotherapy uses one or a combination of medicines to kill cancer cells. You may take chemotherapy medication as a pill, or it can be injected into your veins by the doctor. It is usually taken in cycles, once a week for a few weeks, followed by a break for your body to recover. This type of medication treatment can travel to all parts of your body, which makes it very useful if the cancer has spread. At the same time, it can also attack healthy cells. You may have chemotherapy as your main treatment if surgery is not right for you. The doctor may also recommend chemotherapy before having surgery, as it can shrink a tumor, or after surgery to kill any leftover cancer cells. Chemo could also be a part of your palliative care plan to help control the cancer and ease symptoms. Targeted therapy uses medicines that can kill cancer cells without harming the healthy ones. It can be taken as a pill, or the doctor may inject it into your veins. It is usually recommended for advanced cancer stages. There are 3 main types. Each works a little differently, but with the same intention, to seek out and destroy cancer cells. The first type of medicine in this area of treatment blocks tumor blood vessel growth and can stop vascular endothelial growth factor, or VEGF, from working. VEGF is a protein that helps blood vessels form. In order for tumors to grow, they need to form blood vessels in order to feed themselves. Blocking VEGF starves the tumor cells. Epidermal growth factor receptor, or EGFR, is a protein that tells the cells to grow. The second type of medicine blocks the EGFR signal. This is often used when the lung cancer cells grow too fast because of a change in the EGFR gene. The third type blocks an abnormal gene arrangement in the anaplastic lymphoma kinase, or ALK. This occurs when the lung cancer cells have a change in the ALK gene, which in turn creates an abnormal ALK protein. This abnormal protein causes the cancer cells to grow and spread. Blocking this abnormal protein can shrink the tumor. If you have advanced NSCLC, the doctor may recommend that you receive targeted therapy, either alone or with chemo. You are most likely to have targeted therapy if other treatments have not worked, unless changes in certain genes have been detected. Immunotherapy utilizes some of the newer medicines that are injected into your veins by the doctor every 2 or 3 weeks. They are also called anti-PD-1 medicines, and they help your body's immune system fight cancer cells in a greater degree. Immunotherapy medicines work in 2 ways. First, these medicines block PDL protein on cancerous cells. Usually, these proteins prevent the immune system from finding and attacking cancer cells. Anti-PD-1 medicines keep the protein from working, so the immune system can recognize and attack the cancer cells. Secondly, these medicines engage the PD-1 proteins on the immune system fighter cells called T cells. PD-1 proteins help the immune system find and attack cancer cells. Anti-PD-1 medicine turns off the bad proteins on the cancer cells and turns on the good proteins on the T cells to help destroy cancer. This is comparative to taking the brakes off of the immune system and unleashing its full power to fight the cancer. You may have immunotherapy if you have certain types of advanced lung cancer. Your doctor will schedule tests to see if your treatment is working. It can take 2 full cycles, or about 2 to 3 months, before there are any signs of improvement. You may also need to try a few different treatments or combinations thereof to find the right one for your condition. If you do not see the results that you were hoping for right away, do not give up. You must communicate any concerns with the doctor so all options can be explored. Palliative care is treatment that works to control your symptoms but does not try to treat your cancer. For example, radiation treatment can be given to relieve pain in a certain area. Making sure you feel as good as you can is an important part of your treatment. Be open with the doctor about how your symptoms are affecting your life and work together to find the best ways to manage them. Please feel free to investigate these sites and others for more information, and remember to bring any concerns or questions in to discuss with your doctor. Thank you for joining us today for Part 3 of this 6-part series on non-small cell lung cancer. And come back for Part 4.